check this out. Should never be that way. That is bad. Turn those down some. Check. 1, 2. Hey, hey. Hey, hey.
All right, good morning, everybody. God bless you. Thank you for joining us this morning for our Greater Highway Mastermind Conference, 10 our session on men's health. And so, you know, we're just so glad that you joined us this morning, glad that you are a part of what we're doing. We just want to greet you in the name of our Lord and Savior, Jesus Christ, and just say thank you for joining us. Listen, we've had such a great time in this conference so far. We got off to a great start last night. And Bishop Timothy Newton just preached the house down. And so we're excited because today at this hour we have with us Dr. Noble Thomas, who's going to talk to us about men's health. And so listen, we know that we are blessed men, but even as we heard last night, we don't want to be blessed and then have bad health. You don't want to have to spend all your blessings on medications and hospital visits. And so we want to be well-rounded. To really be a blessed man, you want to be well-rounded. You want to have good finances. You want to have good health. You want to have a good marriage. You want to have a good life. And so we want to make sure that we cover all of that, our spiritual, our emotional, our physical, our financial. We want to cover all of that. And so at this time, we're going to be ready to receive Dr. Noble. But we just want to remind you of a few things. Please don't forget to like, tag, and share. When you think about it, tell somebody, like, tag, and share. And if you have not registered for the conference, please register. We want you to continue to help support the conference. We want to continue to bring quality speakers, and so we need you to register. If you have not, you can still go to our national platform, Greater Highway, Deliverance Ministries, and register for the conference. I promise you, you won't be disappointed. And so it's been great. We thank God for everybody who was able to make it. If you can, please come on out and join us. But in the meantime, we want to prepare now to hear from Dr. Noble Thomas. Let me just give you just a little bit about him. Dr. Noble Thomas was born in a farming community in South Carolina. He attended Francis Marion College and received his pharmacy degree from the Medical University of South Carolina in Charleston, South Carolina. I lost myself here. Give me 1 second here, just a little bit more about him. He was on the Dean's List. He's the founder or served as president of several organizations and received the Undergraduate Research Award. He worked in clinical research at the Medical University of South Carolina Department of Family Medicine, and enlisting, monitoring, and executing study protocols. He completed an elite executive training internship at a major pharmaceutical company. Listen, there's a lot that can be said about him. I'm going to let him continue on about himself. I just want you to please join me, and let's welcome Dr. Noble Thomas. Thank you, sir.
Hello, everyone. I'm glad to be here. And they're going to pass me a clicker, and I'll be with you in a moment. But while they're bringing it to me, I just want to thank everyone for allowing me to come. To Bishop Page, to Bishop Trammell, Apostle Golden, and Greater Highway Online, and the Unity Church, all of you for allowing me to be here to try to share a little bit of information with you. Now working for a long time, I was in like the pharmacy setting, and what I would see when people would come into a pharmacy, they would come in and they have a prescription, and I would say, man, this is not going to help them at all. This may even hurt them. So sometimes what I would do, I would say, I'd tell them, hey, tell your physician to order this test, because what we're getting wasn't going to work. And also I started helping people, giving people herbs from over the counter and things of that sort. And they were getting better results than what they were getting from the medicines. So a few years ago, 5 years ago, we started a clinic where we do holistic health, weight loss, and body contouring in Harrisburg, North Carolina, to get to what's really the root cause of making people not feel well and be ill. So that's kind of how I got my start in it, as well as being on the farm. You know, on the farm, when someone gets sick, grandmother go out in the woods, get some yellow root or something like that, and bring it in and give you that. Had lots of olive oil and castor oil. Now, what we'll find, though, and as we go along, that a lot of those things that they told you that grandmother told you to do was actually the right thing. We're circling it back to it, okay? So I'm going to go through a few slides, and then I would like to maybe have this talk with you guys and have a conversation about some things. Clickers here. I'm going to just get some instructions on make sure I'm using it. Is it, which one is it?
I'll just let him run it. Just tell him next slide.
Okay. Okay. All right. First slide. Yeah. So the main reason that we're here, I could use that pointer, though, if the pointer's on it, is to explore the disparities of African Americans and what we can do. So the ideal is, the topic of my presentation is to empower us to not just accept what we're being told, okay? So that's the main point of what we're doing. So once that's done, everything else is gravy, okay? Next slide. All right, what are some of the prevailing disparities? You know, we have higher rates of hypertension, prostate cancer, heart disease, diabetes, and other health conditions. Usually, if you know, we tend to be at the bottom as African American men in this country. It's not true worldwide. Okay. So some of the reasons for this, sometimes we say genetics, which plays a role, socioeconomics, but the disparities occur even at beyond, no matter what the economic range is level. There's still African American males tend to be lower and have more of the issues. Okay, they asked me to pause a moment. Okay. So, and if you have problems with it, if you can even print it out for me if you need to. All right. So, I didn't want to spend sort of the whole time talking about what's wrong with us, but we just have to mention it a little bit, just to see the contrast. But I wanted to give you tools to use. And so I think they're bringing the... Okay. So the question was, why do we develop hypertension and those sort of things more? Okay. Well, one of the reasons with African Americans more than other people is that our diet, we try to eat like everyone else. Our diet, when they brought us to this country, they didn't bring our food with us, okay? So if we try to eat like everyone else, then we won't get the same results. So I guess since the slide's not working, we can go into some metabolic issues up here. So you have the slides up here. Those work up top. Okay. I can't really see that, but that's okay. Can I move up a little bit, or you can do maybe we can print it real quick. Okay. So, well, the question here it goes into what's called epigenetics. Okay, and epigenetics is influenced by lifestyle. But first, what is epigenetics? We have genetics, which is like we're born with certain genes. That's our horror DNA. Okay, that usually can't be changed in a wide degree once you're born. There are ways now to do it with technology, of course. But then there's what's called, I call it soft genetics. That can be changed. Soft genetics are changed by, let's say, doing all the positive things. There's something called methylation and acetylation. And I had a slide that explains it a little bit. But so you can go to the next slide. Let's see. Okay. So on this slide, it talks about the hard genetics. On my left-hand side, you see hard genetics, and on the right-hand side, you see the soft genetics. On this side is what you're born with, and on this side are things like environmental factors, even things like radiation, even like what comes with your cell phone can affect those soft genetics. Now, what you get, so let's say, let's take, for instance, the blood pressure. Eating like lean, greasy vegetables, add something called methylation to it. And if you go to the next one, and they may be able to see it as well. And go up one more, I think you might be able to see. Okay. On this slide, you can see there's a rod in the middle. You see the DNA, and it's wrapped around something. What it's wrapped around is called histones, okay? All right? And there's methyl groups, which are small molecules, and DNA and acetyl groups, and they turn things on and off in the DNA. The DNA doesn't really control things in the body. People think it controls it. They wrongly call it the brain of the cell, but it does is the blueprint on how things work. Okay, so it's like it provides the diagram. Okay, great, thanks. All right, now I can see it. Okay, so when you look on you see there's a little. I don't know if any of you do tool and die, where you see the tools, they turn around and things turn on and off. That's how it is in the DNA. There's things that rotate and turn things on. There's things that rotate the other way, turn things off, okay? Now, an experiment that occurred in a type of rat. This was done at Duke University. This type of rat, they standardized because they want rats to be all the same, so when they do experiments on it, they get the same results. It's the type of rat that is albino, is obese, and it's white, means white, no color, and obese, and has metabolic issues like diabetes and blood pressure and all that stuff, so they can do experiments on it. So what they did, they fed one of the rats like a regular diet. Then they fed another one like a healthy diet with fruits, vegetables, and those sort of things, right? The rats that they fed the healthy diets began to get color to their fur. They became thinner. These are genetically identical rats, but because they were fed different things happen to them. All right. All right. So now you would think it's just that generation of rats, but some of those changes go to the next generation of rats. You know, in the Bible, it talks about the sins of the father goes to the third and fourth generations sometimes. We found that when these genetic changes, people that eat wrong or have stresses in their body, it can affect generations that go past. It affects how your DNA methylation occurs and what's turned on and what's turned off. So in those stress environments, bad things tend to be turned on. Now, you can modify that. Once you know that may be affecting you some, how you stress, how you think, now you can do things to change that. You're not stuck with it, because it's still what I call the soft genetics. It's things that can be changed. It's not the hard genetics. So you can change those things on how your body responds with blood pressure, diabetes, and those things by changing the environment that your cell is in. Okay? So think about it this. You have when you're born, you have one type of cell, right? There's one cell that becomes all these other cells, becomes skin. What makes the difference? Why does one become skin? Why does one become hair? Or why does one become a liver? What makes the difference? It's the chemical environment that they're bathed in. There's a program, it goes, like you can take cells out of the body, put them in a disc, and they're doing this at Wake Forest now. They add one chemical to it, it becomes a liver cell. Add another chemical, it becomes a heart cell. And they're able to grow bladders and jawbones and things of that sort now, and regrow them by that way. So the whole point of that is showing that there's things that we can do. We're not stuck with how we are and how our body expresses itself. And this complicated slide sort of shows that. Oh, we got it here. Okay. He said it is a beautiful slide. Oh, you understand that? Oh, okay. Oh, okay. There we go. We got a molecular biologist in there, so he understands exactly what we're talking about. Okay. Anyone else medical, or science? Okay. All right. So, in the end, we might call on some questions from you. You might have to help us. Can I advance it here too? Or? Okay. Could you go to the next slide? Too? Okay. Now, there's something called functional medicine, or sometimes we call it holistic medicine. I like to call it root medicine, but some people think root medicine, but root cause medicine. And the difference is that functional medicine focuses on identifying and addressing the cause of conditions, such as diet, stress, lifestyle, hypertension, prevention, heart disease, holistic manner, rather than treating the symptoms. If you go to someone, regular provider, and we're going to talk about this later, and you have, let's say, you can't sleep, what would they do? Give you a sleeping pill, probably Ambien or something. It might not be melatonin, probably, but it might, and give you a sleeping pill. But they might not ask, why is this person not sleeping? What's making this happen? What's making this express itself in that way? Well, that's what we do. We address, why is this happening? There's one person that had, actually it was a type of hypertension, right? And they have gone to all these major centers. And what it turns out in their case is that they had parasites. And it's like parasites that were in the glands. And it's in all the glands through the body. But that's something that wouldn't normally be looked for, So, but we try to go deeper and look for things. In medical schools, we're taught to look for horses, not zebras. So, but we look for horses too, but we look for zebras. Because usually when people come to people like me, they've been to a lot of other places already. So we need to look for the things that are not obvious sometimes. Okay. Yeah, he said things that are not obvious we often overlook, and the answer is yes. And we got to talk a little bit about it, but one of the reasons for that is that most people like me don't take insurance, okay? And the reason for it, if you take insurance, you have to do what the insurance company say. You have to do this step, the next step, the next step. I was having lunch with a physician friend, and she said that while they're arguing, everybody's going to get the same thing anyhow. You know what I mean? Because they have to follow this step, especially if you're part of one of the major health systems. They got to follow this, and if you step out of line, you get a spank on the hand first, okay? There's actually a surgeon friend that got into trouble with this because he wanted to save this guy's life that had sickle cell disease. The hospital didn't want him to do it. And so he went and did the surgery anyhow, and they wanted to take his license and all that. He had to leave the state, okay? But he saved the guy's life. The guy lived. It was fine. But they didn't want him to do it. So so did I answer that question? Okay. All right. Screenings. There's screenings that should be done, of course, to like prostate screening and those sort of things, colon cancer screenings, to cholesterol, diabetes. And those should be done, of course, for early detection. But what's more important is prevention, okay? You have to monitor yourself, but you want to prevent these things from happening. You want, it's another story. I'll save this for later, maybe. Well, I'll tell it now. and I actually have, if you can see this later, is some test results from this is a lady, and she came by. We did a holistic screening, and I would slip through, but it'll throw everybody off to go through the test stream. But we did testing, and she came in for body contouring, because we do non-surgical body contouring and fat removal and that kind of thing as well. So she decided to get the holistic test. When we did the test, we saw that she had conditions in her body. You know, she was really acidic. She had produced some amino acids, and she had some swollen lymph nodes, some tissue in her breast, some glands. So I told, we said, no, all your conditions are right for breast cancer. And she paused. She said, I had 3 sisters die from breast cancer, and I got 2 brothers who had cancer now. And she paused with that. So she said, okay, let's do so. I said, no, we can do prevention. I don't want to, if you do tests and find out you have it, that's a whole nother road you have to go down. And, so she said, and I got a visit with my doctor in 2 weeks, next week. But I want to sign up for the program to help prevent it. So I told her one of the things that I wanted her to do, I wanted her to feel like she wasted money because nothing happened. There was a non-event happened, and she didn't get cancer. Nothing developed. That would be success. Because if she got it, But so she went to her provider, did some lab tests, and she said, oh, my doctor said I'm healthy. Nothing's wrong. So the focus, was on prevention, but sometimes it's instead of problem focus. Coach, question. Go ahead.
I'm a diabetic, and I spoke to a similar doctor as yourself because they got a program. They don't take insurance for some of the same things that you were saying. Now, also, I'm on the insurance side because I work for the company, been doing them for probably 25 years of my career. So from working from them, I'm hearing nothing but prevention, and all this stuff. And then I also hear from doctors as yourself the prevention methods. So I was interviewed by this doctor with the diabetes, and they were going to tell me all they do, and I would have had to pay so much money a month to be part of them because they don't take insurance. Because I'm an educator and I want to learn, I also compared what my doctor was going to do. And in this case, I can't speak for all. It was very, very similar. So as one that has the disease, what does the consumer do in that way? Because we're hearing one side say, they're not doing this, right? Now, I work for health insurance companies, and I'm training people, and, you know, it's all about prevention. It's all about prevention. So what is it that we're not seeing on this end when it comes to things versus what you do on, or I'm not saying particularly you, but doctors as yourself would do? Because I think that's the part that will bring some resolve and understand. Because I mean, and my initial thing to this doctor was going to help me was, I can't see myself kicking out $200 a month when I'm already paying for my insurance. And when they compared it, and listen, what they do was wonderful. I was really looking for something that was going to be different. But my doctor is sharing the same thing. So I need to understand what that is.
And it depends on if your provider is maybe an independent provider with his own office, or maybe with a company like that. If he's with the health system, his hands are going to be tied even more, okay? If he's an independent provider, he may be able to do some things out of the box a little bit. One of the things that happens with people who take Medicare, there's a Medicare score you get. And if the person is not on certain drugs, like a diabetic, if they got to have you on a statin, or they don't get paid as much, they get reduce their benefits and what the hospital or provider would get paid. So, there's a scoring system. So if you're not on certain medicines, no, they just don't get paid as much. Now, there are exceptions to it. I know some of the insurance companies, Humana and some others, they have prevention programs where they, but it still follows mostly, some people out of the box, but follow that same system where you do this. Like putting a diabetic on a statin is something that I would very rarely ever do, because what a statin is going to do, and it's going to decrease your, make your diabetes even worse. So it's not going to, high cholesterol has never been shown definitively to cause heart disease. People with lower cholesterol actually have dementia more, and they live a little bit less. Now, I'm not talking about the extremes high, but I'm talking about high normal. They tend to do better, and they live longer and not have dementia as much that way. Because you got to think that their brain is made of fat a lot. And I'm going off script a little bit, but we can do that. And the brain is made of fat. So, and this is actually happened to, and you know, hormones and are made of fat, cholesterol. So if you're suppressing those things, your hormones, you know, that's going to be off as well. This is there's a neighbor of mine. You know, he's a retired veteran, and his wife asked him to come look at his medicines. You know, he's doing the VA, and I find that some people that go to the VA, as you know, it's harder to reach because they say, "I got my benefits." They want to use our benefits, and he was on a statin, and he's losing his memory. You know, and that's one of the things that some of the simvastatin and other things do. And so I say, hey, you know, he really needs to be off this. You know, if you want to be on something for cholesterol, get on this one, which won't affect it. But he didn't want to do it. Say, my doctor gave me that, and she would hide it from him. He'll go and find it and get upset if he can't find it. And so now he has full dementia. He doesn't know her sometimes, you know that. I'm not saying that's the only reason for it, but that's known to be something that happens with it sometimes. Yeah.
I'm trying to get healed. So that's where mine coming from. So with diabetes, right? We know that one of the medication they give most people, now this is my assumption, is metformin. What would be the alternative? Because many people don't like it. They stop taking it. What would be the alternative holistically for an individual to not take metformin?
Metformin is actually one of the exceptions. It's a drug that I like because it comes from a natural compound, pretty much, and it's been shown to extend life a little bit. But if you want to get the similar effect without taking the prescription one, you can get berberine. Berberine does the same thing on the body, works the same pathway, and you get that without taking that. Spelling is not my best one, but I try. Meet me after class, and you can look. You can look in this book. There's a book. Metformin is under 2,000 milligrams a day. It's generally safe. A lot of functional medicine doctors take it, even though they don't have diabetes. They do like 500 a day or something because of the study that shows extend life. I don't, but some do. It does have an effect, and yeah. I mean, berberine. If I had to choose between metformin and berberine, I go berberine. I put people on berberine. I don't, but I have done metformin before as well. But berberine is what I use more now.
Yeah, I want to add something to that. A lot of times, I've had the chance to work in the pharmaceutical industry for a few years, and what I've noticed is a lot of times the medications that patients usually end up with is steered based off of the formularies that's available to them at the time they're being prescribed medications. So say, for instance, the formulary does say this medication is what we can offer you at this specific time, but because the formulary changed now, this is no longer available to you unless you want to pay a certain cost. So it comes back down to how much a patient sometimes is willing to pay for the best medications. A lot of the switches that doctors prescribe these medications happen at the pharmacy level, because now the pharmacy people now are getting paid to give you a generic, right? So the pharmacists themselves would get paid a certain amount of money now to write these generics, and it's really not about, sometimes sad to say, the health of the patient. It's more about the pockets. And this was one of the big things that we were having arguments with when I was working for Johnson & Johnson, dealing with the pharmacies, because they were messing up the formulations for the doctors for these specific patients. So the patient could have got healed a little bit quicker, but because the patient said, I don't want to pay $60 a month, I'd rather pay $4 and give me that medication, and they end up with their sickness a little bit longer than they would have to. So I think a lot of it comes back down to the cost of the medication, whether or not it's provided on the formulary of that individual. Like when I was living in Virginia, TRICARE was a big thing. So any kind of medications that were on TRICARE, the military people got that from the VA or the vet. The VA when they went there. But if they were on, let's say, Anthem, they were offered a tier 1 drug that basically was at a better cost. It was better for that person. They would actually take that medication. Whether or not it was good for them, it was something that they couldn't afford. So is that still an issue now in the medical field in regards to, okay.
Well, if a person is on certain government plans, Medicare, Medicaid, they require the pharmacist to change it to a generic if a generic is available, unless the physician writes brand name medically necessary, and even then their physician have to fill out paperwork and that kind of thing, and it's be a lot of trouble. Now, one of the things you say is heal. I would say treat it, unless it's like an antibiotic. Most things that are done at conventional medicine is more of a treatment and not necessarily designed to heal the process. Like you come to me with diabetes, my goal is to have you not have it anymore. Okay, so that's my goal. He doesn't have it anymore. He used to have it. so that if you were being seen for the first time, they wouldn't diagnose you. That's what I would say. We don't. Some of the medical system don't like to say we cure anything, but we put it in remission, and so you don't have it anymore. Okay.
They send you when you sign up, they tell you automatically that based on what's prescribed, they're going to always give generic first, unless the doctor prescribes it above that generic level, because it's going to save money. And if you're not an educated consumer, you're going to always just kind of accept what's given. But those who are educated will respond differently, because they'll want something better. I'm sorry. They'll want something better. So it's really educating the consumer about, what he or she should be doing when it comes to their bodies.
Okay. So, those are some good comments, and being aware of what's available. All right. The question was on prostate cancer. It come from online. When should a man be screened and how often? Again, I actually have it here, and we'll get to it, but age 45 is when they recommend, 40, 45. For African Americans, you might want to start at 35. But generally, for the population, it's 45. Because when it occurs in African American, it occurs more aggressively. Just like any man, all of us probably have a type of prostate cancer even now, but you don't die from it. Most men over 50, 60 will have a prostate cancer that is slow growing, and you die for something else. It just never becomes a problem for you. But in African American men, sometimes you can get an aggressive form, and that can take you out pretty much. Now, since we're talking about prostate cancer, and I have a slide on it later, but we can talk about it now. How do you not get it? And if you got it, what do you do about it? One thing that we found to having low testosterone and higher estrogen causes increased risk of prostate cancer. And being zinc deficient, because zinc affects the testosterone levels as well. I was at a lecture one time. It was a prostate cancer survivor group, and there was a guy who came from a major hospital, and he was an interventional nephrologist. And what he did, urologist. He gave drugs to block testosterone. Okay, and he saw me, and he knew I knew what he was doing was not right, and so he kind of avoided me. But when you ask him about it, he says, basically that's my job. He says I'm an interventional urologist. But we know that even now, the theory was that giving testosterone will make prostate cancer grow, and so you block it. Okay. But we know now if you give bioidentical testosterone to people or increase it naturally, which I like to do, then they actually do better and survive better. It's having higher estrogen that causes that. Like I said, I can't skip ahead, but I have a diagram that shows, and that a man, estrogen and testosterone has a pathway. And you see men with man boobs and those sort of things, right? And even people who take testosterone, they can convert their testosterone to estrogen. It's by a hormone called aromatase, okay? It converts testosterone to estrogen. Now, men need estrogen as well it helps our brain, helps our bones. We just don't need as much as women. Okay? We just need a little bit, low estrogen, but you need some. So now, treatment phase, this is pretty complicated, but some things that help for enlarged prostate. Selenium is helpful. Some of the other things like pumpkin seeds and those things are helpful. Selenium is major. Zinc, again, is major for it. There's even one physician in Florida, and what he does, he injects it directly into the prostate gland, and it shrinks the prostate gland. So hopefully that answers that question. There's a lot more to say probably. I have an image of the prostate gland later, and maybe I'll talk a little bit about the anatomy of it. All right. So the next slide was how can an individual empower themselves for better health? And that's about understanding the influence of lifestyle, environment, and genetics, and engaging in the health journey, making informed decisions for healthier feeling lifestyles. One of the things I have sometimes when one of the issues I have is people think of, I'm going to do this for a while, get healthy, then I don't have to do it anymore. Okay? Even in our weight loss program we have, people do it, they lose the weight, and they say, okay, now forget all that. Let's go back. And then they wonder why they gained the weight back. There was actually a physician, he had got cancer, and he did these holistic therapies. He had I think he had 4 months to live or something like that. He did these holistic therapies, and then 10 years later, he doesn't have cancer anymore. I mean, it went away before that, but he's 10 years later. Now, after 10 years, he said, man, I've done this for long enough. Now let's go back and do the regular things. And of course, he died in a couple years from the cancer. It came back. Cancer usually comes back if you get cancer, you don't want to do nothing. Even if you go through the regular therapies, you want to do something to keep it from coming back. Okay. Yeah, I have personal experiences. A sister got cancer, breast cancer. Went through regular therapies, and I think 4 or 5 years later, it came back. So she was, and I was into holistic, trying to say do this. I was trying to send her to that physician in Florida because I'm just a little brother. So, but she said I'm just following what my doctor say. And of course, eventually the physician said there's nothing I can do for you. When that happens, you can say, I'm going to put the foot on the gas and go full force and try to do things, or you can say, let's enjoy this part of life, to go on a vacation or something, which is what she did, and then just let it happen, and she passed. Had someone come to me. They had 3 months to live from cancer. They had come to me before, but then they decided they're going to do regular therapies. So after then, 8 months later, she's alive, no problems, going for walks, and she comes in and say, my doctor don't believe I'm living this long. Can't believe I'm living this long. And she didn't have any pain, no pain medicines. But then something happened, because she had to come to the office to get some things. She said, you know what, I don't think this is working. The cancer didn't grow any during that time. Cancer always grows, continues to grow. It doesn't just stay. It didn't go completely away, but it never got any worse, and it got smaller on the imaging. So after that, she said, going cheap. So she went away for like a month and a half, didn't do anything, stopped doing everything. And when she came back, what the problem was, what it was. It had spread everywhere. And she started treatments again, but by that time, it was her thought processor wasn't right. She wasn't, because cancer produced toxins and make you not think right. You can't make good decisions. So we did lose her. Anyhow, that I still think about that. Another story, just to say, this is when we first opened. I don't know how this guy found us, actually, because we hadn't really done any advertisement or anything. He came to us and said, "Is this a place for health?" I said, yeah, that's our slogan, a place for health. And he had heart disease, and he wanted to get healthy, lose a belly, and that kind of thing. And I said, yeah, I think we can help you with that. His physician, he had a heart murmur. His physician always said for over 10 years, no, it's no problem. It's just, there's nothing we need to do about that. Just watch it. And when he went back and told his physician that he was coming to us and that, we were going to try to help him with it. But now it's an emergency. You need to be in surgery in 2 weeks. And so they put in, and he had that decision to make, but you say, this is my physician. I'm going to. Maybe I should listen to him. And he didn't think that all these years that, you say it's nothing, and now it's something majorly in 2 weeks you got to do. So they put in artificial valve in his heart. So now he has to be on medication for his rest of his life to keep for the artificial valves. So I find that sometimes when people go to, they tell them they come to a holistic provider, even people with diabetes, now they want to do something. Okay, I guess I don't know why that's the case. But maybe y'all can shed some light on why that's the case. But now they want to do something. I don't know. So, all right. So this next slide sort of talks about. I think they're behind a little bit, but it's okay. This next slide sort of talks about the difference between functional and conventional medicine again, and basically it's the same. It's focusing on the conventional medicine focus on two distinct differences: treating versus preventing conditions. Each approach has its own strengths and limitations. So my approach is not always there's drawbacks to my approach too. Okay, so we're not perfect. We're not and we'll go over some of that. This is just some stats, health, and we'll go over some of those. Health disparity, life expectancy at birth in 2003 for black males, 69 years, falling short. Comparable is basically 6.3 years shorter than white males. And the gap has been the same since 1950, that we don't live quite as long. Face higher death rates from things that are preventable. And then this goes over overview of disparities a little bit down this next slide, which we kind of know already. And then this is prostate cancer slide. African-American men have the highest incidence of prostate cancer among all racial groups and ethnic groups, with a rate that is 60% higher, 60% higher than Caucasian men. Okay? In fact, 1 in 6 African-American men will be diagnosed with prostate cancer in their lifetime. And this gives the CDC recommendations, which we'll talk about at age 45, but African-American men should start earlier, especially if there's any history. This next slide talks about the hormone cascade a little bit. And we talked about how hormones start at the top. Hormones start off as cholesterol, okay? And then it goes into progesterone. And I'm going to diverge a little bit and talk and to step into women, because when I look at this, because how women health and how they behave affect men's health. I mean, stress you out or not, right? So when this hormone is low, this progesterone is low compared to this estrogen on this other side, and what happens as women get older, this is when like divorces and things begin to occur, things that never bothered her before, now bothers her. Everything bothers you about you. You know, she's a little upset. She snaps, you know. She may not sleep well. She can go get good quality sleep, can't sleep through the night, and she up and wake. And she's a little anxious, you know, she wasn't that bit before. And at that same point, you know, may begin to, and we do this on a questionnaire. We ask, have you lost any attractiveness to your mate? And a lot of women say, yeah, I'm not as attracted to him as I used to be. And that is often because of this imbalance that's occurring that needs to be, can be adjusted, especially if they've been on birth control pills at some point in their life. It makes it even worse imbalance. Just keep me track on time. But and since I mentioned birth control pills, I'm taking a tangent again. Birth control pills are supposed to sort of mimic what happens in the body, but one of the things they do, progesterone is a natural compound, and they can't really patent it, right? So they put chemicals onto it to make it different, and they actually become more potent in some ways, but it also can increase the risk for breast cancer and cancers in general, and female cancers, okay? And while the natural compound doesn't do that, but those ones that in certain birth control pills, they increase the risk. There's a couple that has natural in it, but most of the ones that are most popular used has the artificial one, and this one's been modified. So that's just on the side, but no, women, if you have a woman that has, on our website, in our resource area, we have a questionnaire for hormone women, and they can go and fill that out and get an idea of what's going on with their hormones. So it'd be something, so any woman you have, especially if they're getting perimenopausal or whatever, but I've seen it happen in younger women too, especially if they've been on birth control. Also. So on this chart, again, we see, if you look down, up, starting with cholesterol, you're starting with cholesterol, and going over to third to it says androstenedione, and then down to testosterone. Then you see there's a pathway arrow that goes to estrogen. Okay, so the estrogen, that's how the estrogen, testosterone become estrogen. Now that last one is one of the factors is why men lose their hair a lot. Because if this part goes down that pathway, then the hair get male pattern, even women get male pattern baldness and things of that sort. Now, women, it can happen for sometimes thyroid as well. Well, it affects the follicles, and it just doesn't hold on to your hair as much, and it just falls out. And it's not like a health. It just shows that it shows the way your body is using your estrogen, your testosterone. Now, you can decrease that with diet and some supplements, like green leafy vegetables and other things. You can take it down a different pathway, make sure your zinc and copper ratio is right, and those sort of things, so you can decrease it, that process. But it shows normally when your test is done for testosterone, even any of the hormones, they're looking at what's in the blood, then they're looking for those main hormones. But they don't look for how it's being used by the body, in which you have to do in a urine test, because how it's metabolized and see how it's being used by the body. The blood test wouldn't show that. And so then you can get an idea of what's been happening. Yes, sir. Okay. The question was, can you reverse hair loss? Okay, you want his hair to go back? Yeah, 32. There's well, first thing we have to correct is the metabolism issue. If you have follicles there, which you would, then no, we can do some things to make the hair grow back. But if the thing that caused it is still there, it's like you got to put out the fire, so a little bit. So you have to do both. So there are things that can make it grow back, and it may not be exactly like it was before, but you can increase it and improve it. Okay. What do you want? Okay. Well, first you probably should get tested and see what happened to your hormones. But there's even things like there's once you stop the process, there's light therapies that can help, that can stimulate the growth of the follicles. There's natural compounds, even like you put a little castor oil base on there, can help some. Then there's something that we do in functional medicine sometimes, where we draw your blood, take growth factors out of your blood, and inject in the scalp to have new follicles grow. And so that's a pathway as well. So the answer to your question is that there's a lot of different modes that can be used. How many married men I see that's losing their hair? Yeah, that's a good bit. Yeah, I mean, if they're married to a woman who's gone through these stages, I mean, the women they don't know what's happening to them. Okay, they don't know what's happening to them when they're going through this hormone imbalance. They just know they're anxious. They're not happy with things, and they don't know why. But but the men, that's when divorce rate happens more, because they used to think it's the man to say, okay, I'm going out and get a younger woman, but things are changing at home. And so it causes, okay, I'm not happy. This woman is, I have heard women say, I married the wrong woman, because they started to change at that time. Oh, before she's the right, perfect woman, and now this changes her. And she don't understand it. She don't know why. He don't know why. And so they're just button heads, And so that's just a side there. But when you look at this chart, you can see how how the prostate can be affected by the estradiol going up if you have too much aromatase, and why men could get man breasts by this happening as well as by getting like the belly fat and things of that sort. Okay, that's very timely. I got a slide that shows part of it, at least up here now. You can go to the next slide. So if you look up at this slide here, this is a slide of male anatomy, and the prostate, of course, is a small gland, typically small, that comes from the bladder. It's not really separate from the ureter, the tube that drains the bladder. It's like part of it. Okay, so that's why when they try to go and widen it, they have to go and they just rule that tissue off, and you see a lot of blood come out and that kind of thing, because it's part of it. It's part of that area around the opening of the bladder. And it's why if it gets really enlarged, if it starts to get enlarged, you may have problems with sometimes erectile issues in urine. You have to use the bathroom more often. You got to go right now, and you got to go more often, because that's you don't empty completely, and it can put pressure on the bladder. As you see, the ejaculation duct goes through it, and the tube that drains the urine goes through it. And so it can create some issues there as well. Okay. Her question was difference between colon cancer and okay. All right. So colon cancer occurs, of course, in this picture. You can see it's the area that's just beyond the anus. It's that last part of the intestine. And colon cancer occurs for 3 different reasons, all right? It's just that one occurs in the prostate, one occurs in the colon. They can migrate, since they're close by, they can migrate, and you can see problems with the colon in the prostate, but usually the other way around, and problems with the prostate in the colon. So that's possible. So it's just the location. Colon cancer, of course, one of the things that we do to sort of help with that is the type of diet you have, using natural fibers and roughage and the bacteria that's in your gut. We haven't talked about bacteria. It's very important, but if you get, maybe at the end, if you want to talk about it, we can talk about that piece.
You started out talking about certain foods. When we came to this country, we didn't bring our foods. And so foods I want to say has a big deal with a lot of our health. Am I correct? Are there certain foods that you recommend while you're going through whatever, that you all do? Are there certain foods that you recommend to help us to have better health? Or are there certain foods that we should just naturally avoid? We know about staying away from fried food, too many fried foods, but are there certain things that you all recommend that we should avoid and certain foods that we should have to help our health?
For a lot of years, I worked with Sickle Cell Foundation, and I started out working with Sickle Cell Foundation. Or near the start. And one of the things that we would do is talk about the diet for sickle cell. And of course, we know that sickle cell disease affects the hemoglobin inside the red blood cell. I'm going on a tangent, but I'm coming to your question. Affects the hemoglobin inside the red blood cell, where the hemoglobin sort of comes together, changes the shape of the red blood cell, they get blocked in small blood vessels and cause problems, right? Well, I had the opportunity to go to Ghana and to some other research places there. What I noticed is that in addition to it being a slightly different variety, is that people tend to do better. Here, people were taking morphine, Demerol for the pain. There, they were doing, it was okay on doing nothing or ibuprofen or something like that. Some of the foods we found was helpful was like the white yam, the cabbage, and the cassava. Those diets sort of cause the cells to change back and not being the sickle shape. So I said that to say that those foods, those types of food are beneficial. Green leafy vegetables, the things that your most southern grandparents fed you, things like the field, the beans, and you notice that sometimes they would put a little fat in it, okay, which we would think would be bad per se, but it actually help our body absorb the fat soluble vitamins out the food. So we got more of the fat soluble vitamins in the food. You can do too much, of course, but so that was some of the benefits of that. So. Other native foods, okra, and things of those sorts are really beneficial for our biology. So, especially in high magnesium foods as well, which we are also deficient in.
Anything is not good for you, but are there any particular foods that you would suggest that we should avoid?
Right. Anything that has high fructose corn syrup in it. And this is one thing you have to read the labels because they meat, bread, and ketchup and all those things. You have to. The reason for that, I don't want to just say it, and I'll give you a reason if you want. It's how it's processed in the body. It's processed by the liver, and it tends to create liver fat. It creates a fatty liver. It creates uric acid, so you get gout, blood pressure, joint pains, bone issues, and it can actually affect the mind from having that increase in uric acid and making your body acidic. One of the things that our grandparents did get wrong, though, was there's a spice called accent. You ever seen accent spice? Okay. if you read that what's in it, it's MSG, monosodium glutamate. That's all it is, pure monosodium glutamate. So maybe that's one of the reasons why grandparents' food tastes so good, because it stimulates the brain to pleasure centers and makes it go into like little flips a little bit, the brain. But it also drives your insulin levels up for days sometimes, for long periods of time. Makes you store fat, makes you makes other bad things happen in the body. So as the lady came in and had to bring, when people come in, somebody had to have to bring what they're eating and things in. So she brought spices. She brought I think she brought 12 bottles. 6 of those bottles has things she shouldn't eat. Another thing is maltodextrin. If you eat barbecue chips, or they usually have maltodextrin or MSG in it. The regular ones don't always have it, but those they tend to be added. There's some kinds that holistic kinds that you can find that don't have it, but most of the kinds have it. It makes you taste more. It makes you eat more. You still want to eat more. You eat more. Okay, and along with that, artificial sweeteners. Now we can take aspartame. Some increase cancer risk, but just about all of them have increased insulin levels, which makes your body store fat and makes you eat more. And one of the reasons they do some of those things is because they eat more. Chewing gum. Most of them have aspartame in it. You make you chew more, you keep chewing, get another stick, chew more. And it's good. They sell more. They actually do studies to find out what's going to make people eat more of my food, eat this food, and they put them in there. So there's to cover sweeteners, we can go into a lot of different ones. Even saccharose, which is it has identical structure to, except for one has a chlorine group on it to sugar, to glucose, regular sugar. But that damages the gut a little bit. It can can cause other problems, integrity of the gut, by damaging gut bacteria. So your answer could be even longer. Okay. So of course, hopefully that gave you some basics at least. Okay, looks like I have to wrap it up. Getting close to it. And flip through some things here. Let's go to the one that shows cardiovascular system. And see which ones we need to cover. I get some stats on diabetes that we got, 5 minutes or? Okay. Erectile dysfunction. I don't know if anyone want to know anything about that. Nobody want to know anything about erectile dysfunction. Okay. Okay. Someone say talk about it. Everybody say we're blessed men. Okay. All right. So one of the ways that the penis gets engorged is that, and women instinctively know it. Women look at men's butt. Men look at their hips and breasts, and women's hip breasts, and look at fertility of the woman and that kind of thing. And women instinctively know if you can push more blood to the penis, can more effectively. And men, as they get older, sometimes they lose the glutes a little bit. But it gets engorged by pumping blood to the penis, and when it gets enough in the arteries, because you go arteries to veins, then it sort of blocks off the veins, so the blood stays there. So once it's pumped there, it gets big enough that it blocks off the veins and it stays there. Now, one guy came to me for, he didn't originally come for that, but he was infertile. He couldn't have kids. They had, and he had problems with erectile issues. So we started him on a therapy, all natural. And it's actually in 2 weeks he came back and he said, everything's like new down there. But, he had, at first, when it first happened, he had pain. Because I say, you're getting pain because you never had blood supply there before. So that's why it's hurting. But he said everything's like new, and, his counts went up and all that. So But no, so it can be modified. When you see this is often, and I think I'm gonna have to cut it short, but it's often has to do with heart issues. Another gentleman came to me. He had 2 issues. His was his heart was not pumping quite effectively like it should be on the scan, and then his prostate was enlarged. It's calcified. I mean, it was hard. It had calcium built in. It wasn't flexible anymore. And so that was a therapy to work on that. That process would take a little bit longer to see the full results from it, because you have to try to change that calcium out of it and he's doing some physical things to sort of impact that as well. All right, so I guess let me flip through, see if there's anything pressing since we're running out of time. I had some other things with women, and some talk about polycystic ovarian syndrome a little bit, and how functional medicine approach it versus not. Thyroid is a big one, because women and men go to the physician and say, "Oh, your thyroid is normal, no problem." I had one woman come to me. She said, I've been telling my doctor I thought it was my thyroid, but for the last 10 years, but he's saying it's normal, because the level that they tend to check, what they check, is based on what's the stimulating factor. But we did a detailed check, and her thyroid was not normal. Her body was making a kind of thyroid that she can't use. So she had enough, but it wasn't useful to the body. So we modified that, and she lost 70 pounds. Okay. All right, so I think had a few other things, but that's vitamin D. So is a really big one. We all should be on vitamin D. During the crisis that we had, the reason that we as the people died more because ours was low. It's my theory, based on what happened here versus other countries. If your D level was below 40, you're at risk. Now, normal in this country is 30 and above. So below 30, they say you may need more. I like between 60 and 80 is what I like. But if you're above 40, that helps with that situation. Okay. What do you say? Well, I don't say the word on, because you might find that you have technical difficulties with your stream. But what was going on in the last few years, the big crisis worldwide. Yeah, I can say it. Yeah, I can't say it. I can't say it. But it also puts you at risk if it's low for cancers, for hormone issues, for depression, because vitamin D is necessary to make the hormones that there's serotonin. So if your vitamin D is low, you won't make it properly. You won't make your sex hormones properly if you don't have it. So that's another thing. It has a lot of different purposes. It's really a hormone and not really, when you look at the structure, it's really a hormone and not really a vitamin. So, and this is the last thing I think I'm covering. Of course, vitamin D should come from, is made in our skins, from type of cholesterol. So again, if we taking something that lowers our cholesterol too much, it might be a problem. And it's converted through a couple steps in the liver and the kidneys. So there's a few places where it can go wrong. Or if you have gallbladder issues, even if you take it, you might not get absorbed properly. So, I do have, I did bring a vitamin D with me that's like really good. And I have it with me if anybody wants some, I have some. Few $100, not that much, not that much. But I do have that if anyone wants some. And I also brought with me something to help with appetite for sugar cravings. You know, we have that sugar cravings late at night. I brought something to cut your sugar cravings in about 10 minutes. That's available as well. So, but if everyone would go to visit the site, and you can. The easiest one to go is a placeforhealth.com. There's True Care Health and Wellness, but if you placeforhealth.com is the easiest way to get there. But and you can do the questionnaire, or if you send me an email or fill out the contact form and say, hey, I just want to be on your list. I'm going to do some classes coming up on do some on sexual health and performance, and I'm going to do some on anti-aging. I'm an anti-aging specialist. I'm 95, by the way, and then of course we do weight loss all the time. So which includes like diabetes and things. Okay. So thank you very much.
Let's give our Dr. Noble Thomas, PD, a round of applause for coming to us. Thank you to our online audience for tuning in on today. Dr. Thomas's contact information is True Care Health and Wellness. info@truecarehealth.com. That's info@truecarehealth.com. And he can be found in this greater Charlotte area. Because of his vast experience working in traditional medicine and then approaching medicine from a holistic approach, he is able to look at all sides of the spectrum in treatment when he is dealing with patients. And he come to us at the Masterman Conference to let us know about the things that directly affect us and how we can be preventative, how we can care for ourselves, and how we can continue to be blessed if we master our own internal body health. So we thank you again, Dr. Thomas, for being with us on today. Listen, to all of you who are online, you may have went to a doctor and you would have had to pay a copay just for a few minutes of their time. You would have had to pay a copay just to see a doctor, an appointment that might have been weeks away. But you just spent an hour with a doctor that has information that is directly affecting you or someone very close to you. And we at the Masterman Conference try to present the best grade of information concerning life and every aspect that will bless a man. And we're going to ask you to sow into the Masterman Conference on today. Some of these seminars cost hundreds of dollars around the country. We're just asking for a $20 seed in this seminar session for the day. Just a $20 seed to the Masterman Conference. The ways to give are on your screen just before we take a break, before we go into our 12 noon worship. We want you to sow a seed. We want you to refresh yourselves. We want you to follow the ways to give on the screen. Come back, because there is a word from the Lord for you in this midday hour from our chairman, the Bishop Terrence Trammell, will bring the word of God to us in just a few minutes. So we do not dismiss, we just transition, and we look forward to you logging right back in at this same place and this same time. Greater Highway, Deliverance and Ministries online, Unity Charlotte online. We'll see you in just a few moments. Please sow on today. God bless you.